The deltoid is a superficial muscle that covers the shoulder joint. It is separated into three parts: anterior, middle, and posterior. All three parts of this muscle are responsible for shoulder abduction, are innervated by the axillary nerve, and attached distally to the deltoid tuberosity. The origin or proximal attachment sites vary for each muscle, and the anterior and posterior deltoid provide a few additional actions to the shoulder joint. The anterior deltoid originates along the outer third of the clavicle, the middle deltoid originates on the acromion process, and the posterior deltoid originates along the scapular spine. Additional actions provided by the anterior deltoid include shoulder flexion, medial rotation, and horizontal adduction, while the posterior deltoid additionally provides shoulder extension, hyperextension, lateral rotation, and horizontal abduction.
Okay, so today we'll go over the testing of the anterior, the middle, and the posterior deltoid. So first, you would advise your patient to be in a seated position. We're going to have the elbow flexed around 90 degrees, slightly laterally rotated, and then I would just ask the patient if she can raise her arm up to the ceiling. So if a patient is able to demonstrate that movement, we would score that a 3 out of 5. Okay, so next, with the testing, I'm going to have the patient raise her arm again, and then I'm going to apply moderate resistance, and then eventually moving to a maximal resistance. So I will stabilize the scapula, hand will be placed right around the bicep, and then starting with moderate resistance, 4 out of 5, to a max resistance of a 5 out of 5. So that was the testing for the anterior deltoid. So our next test today will be the test for the middle deltoid. So the patient can be in a seated position again, and we would ask them to have their elbow bent at 90 degrees, and then we will try to raise the shoulder, good, into an abducted position. So if a patient is able to elicit that movement, we will have a 3 out of 5 score. So now I will be applying resistance to the movement to figure whether it's going to be a score of 4 or 5 out of 5. Okay, so go ahead and raise your arm to that position. I'm going to stabilize the scapula here. I'm going to apply resistance, moderate resistance, so maximal resistance. Good. So there we have a score of 5 out of 5 for testing for the middle deltoid. And so our last test for the deltoid would be testing for the posterior deltoid. So with the posterior deltoid, we're going to have the patient in a prone position on a table. We would have the shoulder that you'll be testing hanging off of the table. So then I would next have the patient have the elbow flexed 90 degrees, and then we'll just slightly horizontally abduct. So she is able to do that against gravity, so she will have a 3 out of 5 score. Okay, you can go ahead and relax. Give her a little break here, and then I'll just have her do the same motion. Okay. We'll horizontally abduct, stabilize the scapula. I'm just going to apply some resistance, moderate resistance to maximal, and she's able to withstand that resistance. So she has a 5 out of 5 score on her posterior deltoid.
Weakness in the deltoid muscle would result in the inability to lift the arm in abduction against gravity. This would lead to difficulty performing a wide array of activities of daily living, since abduction of the shoulder is involved in many actions such as driving, reaching for items in kitchen cabinets, and brushing your teeth, just to name a few. A few of the possible causes of deltoid weakness could include nerve involvement, such as axillary nerve palsy or cervical radiculopathy, commonly referred to as a pinched nerve, specifically to C5. Injury to the deltoid muscle itself could also result in weakness.